This is hip abduction, and this has to be done exactly right or you don't really target the muscle you're going for. This is the intent here is to strengthen the glute medius and minimus, which are hip abductors. There is a group of muscles, or there is a muscle called the TFL, which connects to your IT band, which can kind of take over and do a little more work. That's usually the source of IT band pain. So we're trying to avoid that. So basically make that top leg straight and lift up. You don't want to go too high, that's good. If you go too high and your pelvis starts to tip towards your back, you're using a muscle in your back called your QL. So limit the range of motion. Turn the foot down ever so slightly. That's it. That puts the TFL a little bit of a disadvantage and helps target the glute. So the way you set up is, this has to be a straight line between your shoulder, your hip, and your ankle. So let's get that foot back a little further. If anything, you want to bias back even more so. Now lift up. That's the line you want to be in.